All right, so this video, this is a football player during practice today. He went to break, make a cut. He heard a pop, his knee, he just went down, said his knee hurt. Immediately went on the field, just checked him out, but now for this situation, we brought him into the training room, had to take a look at him. I already asked his history questions. He said he went down, felt a pop. Pain-wise, he said it's bad right now, like an 8 out of 10. He's never hurt his knee before. And then I just asked also if he had to describe the pain. He said it's just sharp right now, just sharp pain. So other than that, never hurt his knee. So I'll just go straight into the observation. So looking at it here, I don't notice any immediate swelling when I'm assessing it. Looking at his patella, his tibia, looking at the joint line, nothing crazy yet. So obviously there's no bleeding, anything like that. Like he's not cold, anything. So now we're gonna move straight. I look in the palpation side. So first just feel his patella. Any pain with this? There's no pain there. That's good. Moving down, get on his epicondyles here. Pain tenderness here. He says a little bit. A little bit. Patella tendon a little. Essentially just feeling for all his structures here. But then mostly after that, I was having him check his range of motion. So just have you actively see if you can send your knee on. He can't do it. It hurts a lot. So then after that, I'm just going to passively bring him over. I'm just going to see what he's got. And this is pretty uncomfortable. So we're not going to do that. So I'll be laid back. So I kind of checked his range of motion a little bit. Since he's already sitting here on the field, obviously I would have ran through all these tests right away. But in this situation, he's kind of calmed down a little bit more. I'm gonna see if I can get a better test here. He might be guarded in a real life situation, but the first one I'll do, obviously, since it's a plant and twist, I'll do Lockman's. So yeah, you can see the camera. So just relax your leg. I'm getting I'm feeling pretty lax for a positive test. So then what I want to try is I'd bring him up. Got him up. And I'm gonna do an anterior drawer. So yeah, you can still kind of see it there. So no, you can't see it. Just relax it, man. Just grabbing here. I'm pulling, and there's definitely some laxing. And he said he's describing pain with that too, so that kind of bothers him. While I'm up here, I honestly do the same thing. Just check. Well, I already got a positive for ACL. I kind of want to rule things out. So check for posterior drawer, negative on that. Have him bring down. Do a reverse Lockman's. That's negative. He's just got a little pain. He's just tender with all of this right now. Then after that, I want to check his MCL and LCL so we can do a varus valgus stress test. Just checking his MCL right now. Doing it. Nothing there. Just bothers him. He's just in pain a little bit. Do it 0 and then 30 degrees of flexion. Not bad. Relax. Check his LCL now. The varus. Not bad. And then also a 30. Nothing there. All right. After that, then I'll try to rule out some meniscus stuff too. So we'll do McMurray's coming through. This is just kind of bothering him right now. I'm not feeling it clicking, locking, but the other tests I could do, I would maybe run through Apley's just to make sure. I could even have to do Thessalys, but since I already got such a positive on the ACL for Lockman's and then the anterior drawer, from here, I'd refer him on. So right now, after this situation, I'd first tell him, here's what I'm thinking I'm finding. So essentially, based on your tests, I think you might have tore your ACL, but at this point, obviously I want to refer to get an MRI, get imaging. So I'd help him schedule an appointment, get that set up, and then go from there essentially. So that's kind of where you discuss the insurance and stuff. But immediate care right now, I'm assuming this happened today. So I was just saying, I brought him in the training room to assess him. So I'm just gonna treat his pain essentially, give him ibuprofen, Tylenol, ice, and then see. Since it's in this situation, let's say it's 6 o'clock right now at practice, probably get him in the next day to see if he can get it the next day and get some imaging, get it looked at. So yeah, it's kind of a quick knee evaluation.